Welcome back, everybody, to the OPT Network. This morning, we're joining with partners in the community that have come together to make our community healthier and better. Who am I talking about? I'm talking about Christus St. Cabrini Hospital and LSUA. We're talking about nurses and how they have come together to put more nurses into this community. Our guest this morning is Dr. Cathy Cormier and Linda Rittermeyer. Ladies, good morning and welcome.
Good morning. Thank you for having us.
So let me start with you, Linda Rittermeyer. You are new to the Cabrini family, but you bring a lot of wisdom, a lot of nursing experience, and so we welcome you to our community. Tell us about all of your years of nursing and what you hope to accomplish at Christus.
So I've been a nurse for more years than I probably want to mention, but close to about 40-ish years. I've been a nurse, and we've seen nursing shortages up and down all through the years. It's always been very cyclic. I will say one of the things that I really would love to achieve here is to make this be the place where nurses want to come to work. If we can accomplish a great working environment, of course, nursing is always stressful, but as less stressful, if you will, as possible. This is probably the worst nursing shortage I've seen in 40 years. I've never seen anything quite like this. And I don't see a silver lining at the end of the rainbow.
Do we know why, Linda? Do we know why people have lost interest in nursing? Is it a loss of interest or what is it? Because it's certainly not the pay.
Well, I don't think it's just a loss of interest, but there's several reasons. So the average age of a nurse right now is 50 years old. So what everybody calls is a silver tsunami. In the next 10, 15 years, a lot of nurses are going to be retiring. They're going to want less hours. It doesn't have to do with pay. You're correct. But, when you're older, you want to take it a little bit easier. So we're going to see a big outflux of nurses. Part of the other thing, and where Dr. Cormier comes in, is that they don't have enough nurse educators. So they actually need a lot more people to be nurse educators. So the statistics, when I looked at the statistics, I found it pretty daunting. That just over the last couple years, they've turned away 80,000 across the country, 80,000 qualified applicants because there's not enough faculty, clinical sites, classroom space, budget restraints, of course, and clinical preceptors. So between, trying to help the nursing schools and trying to get people through schools, and then just the burnout of nursing as it is. Nursing is stressful. And 33% of our nurses leave the workforce within the first 5 years.
Wow.
A lot of it has to do with the emotional strain, the workload, the culture, all things that we try to work on. And our patients are getting sicker. Our population is really getting, their acuity is higher, and we have a lot of people that live longer. So we're looking at a multitude of issues, and then that's why we partnered together, because it's a huge problem for all of us to tackle together to help our community to be able to take care of our community.
Absolutely. With that said, Dr. Cormier, the stress is probably at a level that nurses have never seen, Linda, in your lifetime with the pandemic.
Correct.
So how then do we encourage students, a lot of students that are non-traditional students that would be coming back for a second career, how do you encourage them to take on nursing as a first or second career?
Well, I think nursing is a special profession in that it comes from the heart. So I think helping students recognizing the contributions that they can make to their community in the role of a registered nurse, as well as the professional development and personal reward of being an RN. Linda, I've been in this as long as you have, I hate to admit, close to 40 years. And one of the things that I love about nursing education is I feel like it's been an opportunity for me to merge two passions, my passion for nursing as well as my passion for education. But the intrinsic rewards that I feel an individual gains from becoming a registered nurse, I tell my students all the time, if you sit back and listen and observe, you often learn more from your patients about courage, about love, about patience, and their families than it's just a wonderful profession to be a part of.
Here's what I think, as you were saying that, I think that a lot of people, Dr. Cormier and Linda, have drawn away from that profession because they don't know that it's possible to make it through, because there's so many misnomers, like it's so hard, it's so challenging. How do we help to dispel that, especially with your program at LSUA, and you have so much support for those students that are in any field?
Well, we understand that it's difficult, and it's especially challenging for students. Most of our students here in rural Louisiana are non-traditional. They have family obligations, they have children, they're a primary caregiver for an older adult, they have jobs. And so managing, juggling all of those responsibilities and taking on the rigors of a nursing program can be quite challenging. And that's the beauty of this partnership that we have developed with the Cenla Future Nurses. It has provided the salary for another faculty member to increase our capacity, but more importantly, it's provided $35,000 in scholarships for our students. We gave our first round, or awarded our first round of scholarships in May, and then we had a few left over, so we did it in August. The response from the students was overwhelming. It could bring you to tears. Some of the emails that we got when they received the award, you have no idea how much this will mean to me. My mother lost their job because of COVID.
Wow.
And now I'm going to be able to go to summer school so I can stay on track. So these types of partnerships have really not only addressed, I feel like the mission of LSUA is not only to provide nurses for the healthcare workforce in Central Louisiana, but to provide access to quality education programs to our students who oftentimes would not have the opportunity to go to another school. We provide access to a really strong, solid nursing program. We've been in the LSUA or in the Cenla community for over 60 years. LSUA is celebrating their 60th anniversary this year. And the nursing program has been on the front lines of providing that, or supplying the healthcare workforce with RNs.
Sure. Let's take a break here, but when we come back, we'll talk about the partnership and the alliance that Christus St. Cabrini Hospital has merged with LSUA to create nurses, to churn nurses out to take care of our community. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about community partnerships. Christus St. Cabrini Hospital has partnered with LSUA to churn out more nurses, Cenla Future Nurses. Our guest this morning is Dr. Cathy Cormier and Linda Rittermeyer. She is the Chief Nursing Executive at Christus St. Cabrini Hospital. And so when you looked at the culture and the environment, Linda, of nurses, and you've been a nurse for well over 4 decades, you've seen people come and people go. What is the key? You talked about it in the last segment, about making a work environment where people who obviously have a gift to care for others can thrive.
So I think from the hospital's perspective, when we bring these students on and make sure that they feel comfortable within our environment, because we take externs, we take interns. So while they're in nursing school, while they're still in nursing school, they could come work with us. So we help them get used to what our culture is. I am very much about the empowerment of nurses. Nurses have a loud voice. We are a big population. Personally, I think nurses could change the world, but it is who we are at heart because it's a calling. You don't do this because you just are trying to find a job and a paycheck.
Right.
I didn't do this for 40 years. So for us, because they come from such a great college, and we are able to continue that with our faith-based organization. We've been in the community 70 years, just like the school's been here for about 60 years. So making sure we're doing safe patient ratios with our nurses, making sure that we support faculty with what they need when their students are here. What's future educational opportunities, like Dr. Cormier stops. Your education never stops, even if it's a class here or a class there. Nurses are always learning, so that partnership does not end when they graduate nursing school. And there are many other opportunities for nurses to do from there.
Sure. And so tell us about when you come together with the leadership at Christus and you say, you know what, we're going to offer scholarships to these students to help them defray the cost and some of the weight of going to school.
Yeah, so part of it, I mean, absolutely, that's number one priority because you can't run a hospital without nurses.
Right.
And nursing school, it's expensive. And we would like to help our students it's like we talked about, taking care of somebody else, and even our hearts have that feeling. Sometimes it's still stressful. What a great thing for us to partner together, take that stress off their plate, that they're not worrying about student loans or a higher cost of student loans. A lot of our nurses are single moms and stuff, so they have families, and that's a worry, especially in the midst of this pandemic and all the things that we're trying to do. So anything that we can do with this partnership to take some stress off of their plate so that they can concentrate on that work-life balance. What is it like here at work? What is it like when they're in school? And what is it like at home? So I think that's where our partnership is so important, because it's a preparation of where they're starting from and what they're going to do for the rest of their career. Sure. It would be wonderful to see these nurses that come out from the scholarship sitting here 40 years from today saying, what a great profession this was. And we thank you because we walked away with scholarships and that was a worry off of our plate. For me, that would be icing on the cake.
Absolutely. And so, Dr. Cormier, when you heard of the partnership, talk about what a financial lift that has been and will be for future nurses.
Well, the partnership, again, was a great effort. Royal Martin pulled 6 partners together to create this Send Law Future Nurses program. The partnership is Christus, St. Francis Cabrini, Royal Martin, Rapides Regional, the Central Louisiana Surgery Center, Central Management, and also Magnolia Management all came together to address this nursing shortage and provide support for our students. So again, the students that we serve here at LSUA are often non-traditional students, and the opportunity to give them that financial support so they could stop working as much as they usually do and provide or concentrate more and focus more on their studies is going to help them be academically successful. The other wonderful thing that came out of this is that the Send Law Future Nurses program served as a matching funds for us to apply for a Blue Cross Blue Shield scholarship, which again, towards our commitment of student success, we are now able to have a full-time student success coordinator to help these students. promote their provide more one-on-one academic support for high-risk students, and then another $45,000 in scholarships for our students.
Wow, that's amazing. And so are we seeing a growth in people coming into school to train to be registered nurses?
That is our goal. We're hoping to, traditionally, we have admitted 60 students in the fall and spring, and our goal right now is to increase our capacity to 80.
Wow.
We've had some challenges with COVID. Students are required to meet or complete a certain number of prerequisites. Some students are doing very well and are staying on track. Some other students have difficulty with the remote learning. They need to be in a classroom setting to stay engaged. So that's been a little bit of a challenge. We've tried the nursing faculty here at LSUA has really stepped up to the plate. And I think we had to learn 3 different softwares in the spring when we transitioned.
Right.
We had to do remote testing with proctors. We had to do remote teaching, and all while at the same time remaining committed to engaging those students. And really, when we went remote, we were committed to doing the same things we do in an on-campus classroom. So I really have to compliment my faculty. It's been a great team effort to keep these students on track. LSUA has also recently implemented a new curriculum called a concept-based curriculum. And what we're seeing with that new curriculum is an increase in retention. So not only are we working on trying to increase our capacity for admitting new students, but also to retain more students within the curriculum. Both of those things will contribute to increased nurses for the SENLA workforce.
There you go. Before we've got to let you guys go, give people the website, Dr. Cormier, on how they can connect with the nursing program at LSUA.
So if you are interested in pursuing nursing as a professional career, I would encourage you to visit the LSUA website, lsua.edu. You can apply to the school online, and then you will be connected with a professional advisor to help you with your curriculum plan.
There you go. May God continue to bless the work of both of your hands and the community partners in creating and churning out SENLA's future nurses. Thank you so much.
Thank you so much.
Thank you.
Indeed. Hey, everybody, stay on point. We're back after this.